I'm quite certain that you're familiar with the phrase and the concept that you cannot manage what you cannot monitor. And that's actually been a common theme in performance management in all organizations. Unfortunately, that's really a retrospective view that looks at what has happened in the past, and one takes an evaluation of that past activity, tries to use that as learnings to help you to model future behaviors that you hope will change trajectory and improve performance. That has some definite benefit, but unfortunately it doesn't go far enough in really solving many of the performance issues that our healthcare organizations and regional authorities in healthcare are facing today. To really appropriately get the optimal outcome in your performance, you want to be able to model the future. And if you're going to model the future, you have to understand what is ahead of you. And in the case of wait time performance, you really need to know what is sitting in doctors' offices in the way of the number of patients on individual wait lists. You have to know how long they've been sitting there. It seems like a fairly basic concept that you can only really optimize if you're a hospital and you have hundreds of surgeons that you're working with, or if you're a regional authority and you have 5 or 10 times that same number of surgeons. You really do need to know what's happening in each of those offices and get down to that granular level of prioritizing where you want the activity to be extracted from those offices into your OR blocks and maximize your outcomes. We were quite shocked to discover when we asked that question, because we did reach that next stage of our performance development, that our hospitals couldn't answer it for us. And their status was that they really only were aware of that information about 7 to 10 days before a surgery would occur. Anything beyond that was not actually known to the hospital, only known to the doctor's office. And certainly that meant the hospitals were not optimizing, and we were nowhere close to optimizing. So as a LHIN, we pursued with our hospitals any form of technical IT solution that might help us to more successfully do this. We became aware through that process when we put our call out that Novari had a solution that aligned very well to what we were attempting to accomplish. And we undertook as a LHIN to finance and implement this across all of our 7 hospitals that do perform wait time surgeries and diagnostic imaging procedures. When we moved into implementation of this, we were suddenly in a position where, as we began seeing some of the hospitals come online, that the hospitals themselves started identifying a number of additional benefits beyond the ability to model the future and understand that pressure. They started to see efficiencies in the fact that the direct electronic link from the doctor's office to those OR booking schedulers led them to have optimization of every OR block. Very little time is now lost to the system. They also found that they were able to do this with far fewer staff than they had previously. And on top of that, we saw an enormous benefit in improved data quality. Our data quality has always been a challenge, and I think is a challenge for all health funder and provider organizations, that it requires a lot of manual processing normally to correct issues that actually show you more real results and optimize your wait time performance. In the case of our Novari application that we've implemented, many of the data improvements happen automatically. We now, as a LHIN, are able to let the system fix things that previously we had to pay for. We would actually have to use some of our scarce resources to go out and actually purchase additional resources to push into the doctor's offices to try to improve that data. This now is actually just one of the added benefits that was unanticipated, but certainly quite welcomed. We're very, very happy with the outcome. Our 7 hospitals are performing with much better wait times, much of it attributed to the success of our application that we've implemented. And in fact, we are so happy with this that we have made a commitment to move forward and explore with Novari the potential for an option to now add diagnostic imaging into this same application. That continues to be a very significant struggle in our LHIN, that in particular the magnetic resonance imaging has been a difficult wait time to crack, and I think that's the case across the entire country. We actually expect to see improvements, again attributed in large part to our success with this application.